Well, actually, I started when I was on holiday, on vacation, and I was in Guatemala, and I had the classical disease of the traveler. And so when I came back from this holiday, my father asked me whether I had taken the probiotics. At that time, they were called fermenti lattici in Italian. So I realized that if you have a good and in shape microbiota, then you can actually avoid the traveler's disease. And so I started understanding that this is something that I wanted to work on. Well, there is not yet an agreement, but in my view and many other researchers, the microbiome is the genome associated to the microbiota. So microbiome meaning only the genome. While microbiota means also all the species that are associated to an environment that could be the gut or the skin, because we can find the microbiota in every surface that is associated with the external world. There are other people that think that microbiome means the species and the microenvironment and the genome, so everything together. In my view, it's better to say the microbiome regarding the genome and the microbiota regarding all the species. Yes, so it's very important to say that each individual has its own microbiota. So it's like a fingerprint of an individual, but this is not a static fingerprint, because differently from our genome, which is less dynamic, let's say, because except for the epigenomics that it may change your phenotype, then the microbiota composition is also dependent on the environment. So I have my own fingerprint of the microbiota, but this doesn't mean that it's like this, can be like this forever. So every external interference with the microbiota may change the composition of the microbiota. So everyone has their own microbiota, but this is not static. Yes, there are several factors that are contributing to a changing composition of our microbiota. So first of all, how you were born is already giving a jump start of the microbiota, meaning that if you are born by natural delivery, your microbiota at the beginning is more resembling that of the vagina of the mother, while if it is a cesarean delivery, then the microbiota is more similar to that of the skin, which can be of the mother, the father, and all the individuals with whom the newborn is coming into contact at the beginning of their life. But then there are different factors that are contributing. So in part, genetic factors, and this is also dependent on the inheritance of the microbiota from the mother, which is also pretty important, because also during lactation, the mother is transferring with the milk some microbiota and also immunoglobulins that are important for shaping the composition of the microbiota. But then during the lifetime, people, the way they eat is also important for the composition of the microbiota. So a diet which is a balanced diet will have as a result a more diverse microbiota composition, while if you have a diet which is a poor diet or rich in fat or in sugars, which is also drastically changing the composition of the microbiota. And then we also have some influence from antibiotics, because antibiotics, as we know, are affecting the infectious agent, but they're also affecting the microbiota composition. So the broader are the antibiotics, the more effect you will have on the microbiota. But also physical differences like temperature might change the microbiota composition. So during cold or humidities, you can have different microbiota. This could be due both to the different diet that you have in different times of the year. And typical is what has been seen in some African populations, in which, depending on the season, the microbiota is also changing, because if you have a raining season, then they eat differently from when they have the hunting season, so the dry season. So they eat more meat during the dry season, and so they have a different type of microbiota. It's a very difficult question to answer, because while it's very easy to say that we have a dysbiosis, because we have a change in composition as compared to the average composition of the healthy population, it's very difficult to identify a unique microbiota which is characteristic of a healthy population. Also because the concept of healthy is changing over time, because any individual will have some small different things, or some little, I wouldn't say diseases, but disorders. For instance, if you suffer from irritable bowel syndrome, can you consider yourself as a healthy individual? Yes, but at the same time you have you still have bloating or abdominal pain, which is associated to eating some food as compared to others. So it's really very difficult to identify a microbiota which is ideal for a healthy person. What we know is that, for instance, you can have a fecal microbiota transplantation, which is used to treat some disorders. Like, for instance, if you have a Clostridium infectious disease, you can have a fecal microbiota transplantation. And there are some donors that are considered as super donors, because these are the ones that have a healthier microbiota, because it's more varied microbiota. But the ideal composition, we still do not know which one is it. Yes, there are sex and gender differences, which also depend on the period of life of individuals. Because if you have a child that is not yet undergone sexual maturation, then the microbiota will be more similar between males and females. And then when you have the exposure of hormones, then you start dividing the microbiota in two. There are more female and more male related microbiota. But then if you look at the woman during the different periods of ovulation, they also have a different type of microbiota. So it's a female microbiota, but it's dependent also on the period, on the cycle of the estrogen cycle of those women. But then if the woman is undergoing menopause, also the microbiota is changing, but it's not becoming more like the male microbiota, but it's a completely different new microbiota, that of the woman that is under menopause. So let's say that this is why it's also very difficult to study the microbiota, because there are so many variables that are involved in microbiota composition, that you have to take into consideration all these different variables. Yeah, there are several diseases that have been associated with a different composition of the microbiota. Actually, practically all of the diseases, if you analyze a fecal microbiota of those individuals, you can say that on average is different from that of healthy individuals. So it looks like there is always a change in microbiota composition. Now the question is this change a cause or an effect of the disease that you are looking at? Because if you have a microbiota which is changed, this could be because that disease is also modulating the composition of the microbiota. That could be, for instance, clear in colorectal cancer, because when you have colorectal cancer, you also have, in most of the cases, bleeding, and this is so you have a lot of iron that normally you would not see in the intestinal lumen, and this might have an effect on the microbiota. But on the other hand, what we know from animal studies is that the composition of the microbiota sometimes is changing even before the development of the disease. So it looks like it's more of a contribution to the development of the disease. In addition, if you take germ-free animals, in most of the cases, they do not develop the disease, even if they have a genetic predisposition to the disease. This has been demonstrated, for instance, in cancer, but also in some autoimmune disorders, in which if you do have a germ-free condition, so meaning that the animals do not have their microbiota, then the incidence of the disease is dropping, so suggesting that the microbiota and the genetic predisposition are both involved in the disease. So it's not just an epiphenomenon of having that disease, the change in microbiota composition, but is occurring even before, and it's actually responsible for the development of the disease. Yeah, that's the most difficult part, because we know that we still have to work on this, because, for instance, a change in microbiota composition might be important for several purposes. The first one could be early diagnosis of the disease. For instance, in colorectal cancer, we know that patients with colorectal cancer, they have a typical signature of the microbiota, which is not normally present in healthy individuals. So instead of just doing, for instance, a occult blood in the feces, which is the classical screening for colorectal cancer, you might end up having a microbiota analysis, which could be more sensitive and specific for the presence of a tumor, as compared to occult blood, which could be related to many other things rather than just cancer. So this could be a second step. Maybe you could do occult blood in the feces, and you could do a microbiota analysis, and then if necessary you go in colonoscopy, and so you would avoid unnecessary colonoscopy for those patients that actually do not have a disease. And this is one possible use of analyzing the microbiota. And then we also know that some therapies, they are affected by microbiota composition. For instance, in oncology treatments like immunotherapy, we know that if you do not have the correct composition of the microbiota, you may not respond to the therapy. And this is the reason why they have shown that if you do a fecal microbiota transplantation, starting from donors that have responded to the therapy into patients that have not been responding to therapy, these can acquire the ability to respond, meaning that their microbiota was not capable of increasing the efficacy of therapy. By contrast, a new microbiota may render them more responsive to therapy. And this is probably the most interesting development of microbiota, because you may decide whether you want to first analyze the microbiota of that patient and see whether you should change that microbiota before treatment, or after treatment, if they are not responding, to maybe change the microbiota composition, which could be done with this transplantation, but you could also use the diet, because we know that a high fiber diet is associated with a better response to immunotherapy. So these are things that might change the clinical practice in the future. Well, the microbiota seems to be very important also for our mood, because we know that the microbiota itself can produce neurotransmitters, and this could have an effect on what is the second brain, because in the gut we have a very numerous number of neurons associated with the enteric nervous system, which respond to the microbiota, not only for the neurotransmitters, but also other active molecules that might directly or indirectly through epithelial cells and other cells like in the neuroendocrine system, which can mediate the effect of the microbiota directly on the enteric nervous system. But then we also know that the gut and the brain are communicating through the vagal nerve, And so they receive impulse from the brain, but they also send impulse directly to the brain through the vagus nerve, which can also respond to an inflammatory stimulus that is ongoing in the gut, which is also associated with the microbiota. And finally, we have a direct interaction between the gut, the liver, and the brain through a vascular axis. So we have the portal circulation, which is connecting the gut with the liver, and then from the liver we have the systemic circulation, which is directly connected to the brain. And actually, one of our studies has demonstrated that if you have a change in intestinal permeability, so if you have an increase of intestinal permeability, then you have also a change in the vascular permeability. And so some unwanted molecules from the gut can penetrate into the circulation and can reach distant organs, including the brain. And here in the brain, we associated an additional defense mechanism of defense, which is at the level of the choroid plexus. So the choroid plexus, which normally is quite a permissive barrier, because it's important for the filtration of blood to generate the cerebrospinal fluid. If you have an inflammation in the gut, the choroid plexus becomes less permissive, because you don't want that these inflammatory mediators that are coming from the gut may also penetrate into the brain and induce an inflammatory response in the brain. So the choroid plexus becomes a real barrier, and so it controls what penetrates into the brain, and it avoids that this inflammatory response is propagating into the brain. What is the result of this? The result of this is that the brain is isolated from the rest of the body, and this is responsible for an anxiety and depressive-like behavior. And so when you have an ongoing inflammation in the gut, which might also not be an overt inflammation, so you don't even realize that you have this inflammation, this may end up with a closure of this barrier and the isolation of the brain from the rest of the body. And so this anxiety-like behavior, which might find its root into the gut and not into the brain. And so this is opening completely new ways of treatment for patients that suffer from this kind of mood-related disorders, and probably many other neurological disorders or neurodevelopmental disorders like autism, for instance. They might find a reason in the gut and not necessarily only in the brain. There are two possibilities. One, which would be, for the moment, is science fiction, is to heal yourself with the microbiota or with the food, which I still think we are a bit far away from. But then you can definitely prevent some disorders by a healthy diet, because we know that many disorders are actually associated with an unhealthy diet. And this is most likely dependent on the change in microbiota composition, which is then responsible for the development of the disorder. So, for instance, a metabolic disorder like obesity and non-alcoholic steatohepatitis, or all the steatohepatitis that might end up in the liver, these are directly dependent on the microbiota composition and on the intestinal permeability. So what is called the leaky gut seems to be one of the major problems associated with several of these diseases, particularly in the metabolic syndrome. So if you have a diet which is full of fat and sugars, simple sugars, this might induce the development of an inflammatory microbiota, which changes the intestinal permeability, so inducing what is called the leaky gut. And this is then responsible for unwanted molecules to reach the liver, and then to start to participate to the development of a fatty liver first, and then steatosis and also hepatitis. So, and this is then responsible for most likely the development of insulin resistance and the metabolic syndrome. It's like a chain. So if you have a change in microbiota composition related to an unhealthy diet and full also for processed food, this can end up with a liver disease and the metabolic syndrome. So we are still, I don't think we're still there to cure a disorder, but definitely we can try to prevent it just by a correct lifestyle, which means a balanced diet. The Mediterranean diet for the moment is the only one that has been associated with lower risk of cardiovascular diseases and obesity, and cancer as well. So the best thing to do is to stick to a Mediterranean diet, which doesn't mean only pasta and pizza, but it means also vegetables and fruit and very varied diet, and also nuts and olive oil, whatever can and fish, whatever can help having a balanced diet. And at the same time, also physical exercise, which is becoming more and more important, not only for a well-being, but also for a correct microbiota composition. It has just been shown that if you are exercising, then you are inducing the development of a particular type of microbiota species, which are releasing fatty acid amides. These are small molecules that can penetrate into the gut. They reach the brain and induce the release of dopamine, which is giving us the pleasure of the exercise. So if you exercise, then you are expanding this population of bacteria, which is then inducing more production of dopamine, and then we have more desire to do exercise. And so the reason why the more we exercise, the more we would like to exercise. This is because our microbiota is teaching us that exercising is good for our health and is giving us rewards out of the exercise. So I think that we can, with our diet, we can definitely modulate our microbiota and improve our health. And also with exercise, we can at least postpone the development of some disorders. So let's start from the beginning. So prebiotics. So prebiotics is the good food for the microbiota. So let's say the fibers. So fibers are driving the development of a good microbiota, and this is why it's very important to have a fiber-rich diet, because this is driving a good expansion of the good type of microbiota. Then we have probiotics, which are the bacteria that you can provide from externally, and this can be achieved either via the use of food rich in probiotics, which could be fermented food like yogurt, kefir, miso, and all these more ancient food, which was fundamental when we didn't have refrigerators, because fermented food is capable of surviving for many days, even at room temperature. So these probiotics are found in this type of food. And then we have the postbiotics, which are what the microbiota is producing during the fermentation process. And the postbiotics are actually the small molecules that are responsible for the activity of the probiotics. So you can also consider the prebiotics as the seed, the probiotic as the tree, and the postbiotic as the fruit. So if you want to have a very quick effect, you should go directly for the fruit, because this is what is driving the activity of the probiotic. If you want to, if you have longer time, you can go for the seed, so for the prebiotic, or if you have intermediate time, you can go for the probiotic, so the tree. And you can also go for a combination of these different things, which is the symbiotic. It's like taking the seed and the tree, and sometimes also the postbiotic at the same time. So you want to have an effect on with the seed on the microbiota of the host. With the probiotic, it's on the microbiota, but also on what the probiotic can produce. And then the postbiotic, which is readily available. So if you want to have a very quick effect, you go for the postbiotic. It's like having the fruit. If you want to have a very long-lasting effect, then probably you go for the prebiotic. But the prebiotic and the probiotic are really dependent on the host microbiota. So if you have a microbiota which is very affected, highly affected, then probably you should go first for the postbiotic and then try to reintroduce slowly with the prebiotic and probiotics a correct microbiota. Yeah, fecal microbiota transplantation is a practice that is not normally used in every hospital. So there are some hospitals that have been approved for the fecal microbiota transplantation. This means that you have to find a donor, and the donor is providing the fecal material. In the fecal material, we also find the microbiota of that particular donor. And then you can transfer this microbiota in terms of pills or through gastroscopy or colonoscopy directly into the acceptor, which is a person that has probably a microbiota so screwed up that you need to change it completely, and then you do it with the fecal microbiota transplantation. So this is a procedure which is approved also in Italy for Clostridium difficile infection. So Clostridioides difficile infection. This is the new term for Clostridium, and so it was nice. There was the first demonstration that this fecal microbiota transplantation was working was a clinical trial in patients with a Clostridioides difficile infection. And the people could tell, even though it was a blind clinical trial, meaning that they didn't know what they were getting, if it was a placebo or if it was the fecal microbiota transplantation, but they could tell if it was a placebo or FMT, because those that were receiving the FMT were all feeling much better and they had no diarrhea anymore associated with the disease. And they started recovering from the disease. So at some point, for ethical reasons, they had to stop the treatment because it was so clear that the FMT was working that there was no point to continue with the clinical trial. And so all of the placebo control were getting into the treatment arm in order for them also to benefit from the transplantation. And then they're using this FMT for now just for some research purposes in treatment of in treatment oncologic treatment, because it has been shown that it has an effect. And there it's easier to find the donor because you can take as donors those that have responded to the treatment, because they have a better microbiota composition as compared to those that have not responded to treatment. But recently there was also a paper in which they used a microbiota from healthy individuals, and also they can see a benefit, especially if it is a super donor, as I was telling earlier. So this is a practice that probably is not going to be a massive practice because it's not so easy to find the right donor and then to do the transplantation. But in some cases where it's necessary, then probably this will become one of the possible treatments. Yeah, I think it's a completely new revolution of medicine, understanding how the microbiota is actually interfering with cures or improving cures. So we are expecting to see more and more, because for the moment, the field that is more advanced is cancer, but I'm pretty sure that there are other fields that will benefit from knowing more about the microbiota. For sure, it's neurological disorders. So we are facing a pandemic of neurological disorders of the elderly, because we are getting more and more our life expectancy is increasing. So some disorders that we had no time to see, now we start seeing, like Alzheimer's and Parkinson's. They are both associated with a change in microbiota composition, and probably is a change that is occurring very early in life. And so you might use this as a diagnostic tool for the future, or you might, by changing the diet, if the microbiota is really involved in the development of these disorders, you may reduce the risk of these people to develop the disease. So, and this is one of the fields that I think will take more stage in the future for the study of the microbiota. Similarly, for autoimmune disorders, we already know that most of the autoimmune disorders are associated with a change in microbiota composition. And we know that in most of the cases, in this case, we can actually at least reduce the symptoms of some diseases just by modulating the diet and doing more exercise. And in the book itself, we say that people think that if they have rheumatoid arthritis, for instance, they think that they cannot exercise. We suggest exactly the opposite, to exercise, because the less you exercise, the more you will see the symptoms of the disease. So, modulating the microbiota will have an important effect on reducing the symptoms of some of these diseases. People will still have to take medications. This is very important, because it's important to leave the message that we are not curing, but we may help both improving the symptoms, but also improving the side effects that are associated with some drugs. For instance, we published a paper in which we show that cancer patients, breast cancer patients, that normally take a drug which is inducing gastroenteritis, but this drug is very powerful, but clinicians don't like it because of the very high gastroenteritis and severe gastroenteritis that the patients are observing. And so just by providing a postbiotic, which is reducing these side effects, the patients are feeling better. They don't have to reduce the dose of the drug, and they don't have to interrupt the treatment because of the side effects. And this is improving the quality of life of the patients and the treatment itself, because you don't have to reduce the dose of a very efficacious treatment that clinicians don't like to give to the patients because of the side effects. So these are all new areas of studies that are getting more and more the stage in the new precision medicine.